Does your preschooler stutter? Here's information for you as parents. Have you ever been concerned that your child might be stuttering? If your child is disfluent, our program will be able to offer you effective intervention. Here's some important information about what stuttering is and what you can do to help. My name is Marlene and I'm a speech-language pathologist who's been with the program since it first started in 1998. In part 1, I will tell you how to recognize whether your child is stuttering, and in part 2, I will give you some strategies to help. Here's part 1. So what is stuttering? Well, stuttering happens when the forward flow of speech is disrupted by repetitions, prolongations, or blocks within words. When a child stutters, we sometimes hear them using sound and syllable repetitions. These might sound like, I want more juice, or Mommy, can I go now, or can you help me build my tower? At other times, we might hear prolongations. Now, prolongations happen when a child stretches out a sound or syllable and might sound like this. Why do I have to go to bed? Can I have some juice? Or my car is stuck. Other times, we might even hear a child block so that they get completely stuck and can't seem to get the word out. That might sound like this. I want juice, or, but that's my ball. These repetitions, prolongations, and blocks usually happen at the beginning of a word or sentence. Occasionally, we might hear them in the middle of a sentence at the beginning of a phrase. Almost everyone has times when they repeat a few words like, can I eat this chocolate? Or they change their mind about what they're going to say, and they might start again. These kind of speech disruptions, which happen between words, are not typically regarded as stuttering unless they happen really often. You might want to know when stuttering starts. Well, it usually starts when a child is going through a language spurt, and they can begin any time after they start connecting words until they're about 6 or 7 years old. Sometimes stuttering starts gradually and you might not even notice it until suddenly you start hearing more and more of the symptoms. At other times, it might begin quite suddenly, and the child might be quite distressed because they can't get their words out. Some children do seem unaware that they are disfluent, and they don't react to their speech. They usually just carry on talking using easy repetitions. But other children might become more aware of their stuttering. This we can notice when they become a little distressed or even say that they cannot get their words out. Sometimes you might notice them tensing up or struggling to push their words out. Some might even try to force those words out by waving or stomping or shouting or touching their mouths, even whispering. Some children might even try to avoid speaking or talking less and might choose different words to say. If your child is showing signs of tension or awareness, it is important to seek out help as soon as possible. Stuttering can also be quite confusing because it tends to come and go. We call this cyclical, and stuttering can also be highly variable, ranging from quite severe to almost absent in a short period of time. So your child might stutter a lot sometimes, and at others very little. And sometimes it can be very severe and then wax and wane. And just when you think the stuttering has gone forever, it can sometimes come back again. There are a lot of strategies that you can use to help your child become more fluent. You'll find these on my next video, which is part 2. We also have on our website an excellent video called 7 Tips for Talking to the Child Who Stutters. You can find this video under the Speech and Language Resources tab in the Stuttering section.